Hi, it's Diane with Girls Globe, and today we executed an exciting experiment with WaterAid and Laerdal Global Health, and we asked conference participants if they had the strength of a mother in need of clean water.
Very tired.
Very tired.
Back is very, very tired. This experiment, it shows how do they feel. The object is very heavy, so we have to experiment how they feel.
Fantastic. So you carried some water. How many kgs or how many liters do you think is in there?
About 20 kgs, I think.
About close.
Yeah.
It's about 25, guys. And so how did you feel about the whole thing, about trying to balance the baby in front of you and carrying the water?
Yeah, it's like doing two important things at the same time, right? Like the baby is fragile, right? And the water is important too. Really, it's a terrible problem, and it's a big problem because if you evaluate the importance of water, first of all, childbirth is a fragile process, right? You evaluate the importance of water too, and its unavailability in these conditions is really dangerous, I can say. Yeah.
How are you feeling?
I'm very tired from holding that bottle of gallon of water.
Okay, what is your name and which country do you come from?
My name is Neha and I'm from Pakistan.
Okay. How did the experiment make you feel and what was the experiment about?
The experiment, from what I understood, was about the kind of being in a woman's shoes to understand how she feels when she has to make sure that her baby's okay while she carries water from, and this is just a couple of feet, but what women usually do is like they go uphill, they walk miles for water every day, right? And they have to make sure the baby's okay while they do it. And I'm thinking about how tired I feel just by doing that, and it's making me realize how difficult it is.
So interestingly, like when women are going into labor in developing countries, about 35% of the healthcare centers that they seek these services do not have access to clean water. So what that means for them is that they have to carry this water and sometimes up to 3 times this quantity to the service. How does that statistic make you feel?
That's very scary. And being in labor and caring, I also work as a community midwife in Pakistan, so for me it's particularly scary, the idea that someone would not have access to clean water while going for a delivery and that they would have to arrange for it themselves when they're in such a difficult situation.
Okay, good morning.
Good morning.
And how are you today?
I'm good. How are you?
Very good. Please tell us your name and which country you come from.
I'm Franklin Paul. I come from India. I live in Chennai in India.
Fantastic. And what are you expecting this morning? I can see you're carrying a baby in front of you.
Yeah, I'm really looking forward for this experiment. So I'm still not sure what exactly I'm going to do, but I'm looking forward and excited for this.
Thank you.
Thank you.
I can see you got the water here.
Yeah, but I was supposed to carry it on my back, but I actually it's very difficult, and I'm not sure I'm very good on technique on how to carry it on back or on head. So I actually carried it on, I just dragged it here.
And did you find it easy carrying the water and still remembering to support the baby?
Yeah, I was thinking not to hurt the baby, but when I was carrying, I thought if it was a real baby, I would have hurt it, and yeah, it's very difficult for me to actually think how to carry this and also to make sure that the baby is not hurt or is not injured. Yeah.
We'll give you a moment to breathe. In 35% of healthcare facilities in developing countries, we actually have women who have to carry water when they're going into labor and during the childbirth process. How does that fact make you feel after going through this experiment?
Yeah, actually, like I was like aware of the fact that people face difficulties when they have like newborn and they have to go for water, but I never experienced it, like how difficult it is. And maybe this is a very short distance, but this is the first time like I was able to experience like how difficult it is for them to like walk for like kilometers for getting water. And yeah, and like I empathize with them, like what
my back hurts now.
Okay. Please introduce yourself.
My
and
name-
where you come from.
My name is Elise Young, and I'm a senior advisor for gender mainstreaming and thought leadership at FHI 360. I gave birth naturally, and it took me 29 hours, and I can't imagine carrying enough water to have that for 29 hours. So that shocks me.
Fantastic. And you mentioned you work for FHI 360 and the gender mainstreaming. So having known this statistic, what does that mean for your work going forward? What message would you like to share out there?
Urgency. It is easy for a statistic to become a statistic, and finding a way in our work and how we embed this within our projects and our design and how we partner, expressing the urgency and the back-breaking work, making it human to our own staff internally as we're plotting out plans and budgets and design.
So how did the task make you feel?
Encumbered.
Encumbered.
Yes.
And how long do you think you would have carried the water the way you were carrying it?
Oh yeah, that's why I used two hands, because my left hand would have gotten too tired. I could probably do maybe 200 yards, but no more. And my home would definitely be farther than 200 yards from the tap.
For sure. Another statistic that WaterAid has actually shared with us is that about 35% of healthcare facilities in developing countries do not have access to clean water for women who are going into labor, women and girls who are going into labor. And so this means that they have to carry at least 3 of this to facilitate the labor process. How does that statistic make you feel?
Horrible. I know the importance of hand washing, be it childbirth or for any other health services. And if there isn't adequate tap water, it doesn't happen. Health workers are overwhelmed with what they have to do already, and if we make it difficult for them to do even the most simple, safe things like hand washing, and to hand wash, if you need to carry water, you can bet they won't carry the water in the hand wash because they have many, many other responsibilities pressing on them.
Very well said. And now that we know that, what do you feel we can do as a society? What message do you have for people who are watching that we can change about the statistic?
Well, simple things matter. They matter the most, and it's not about technology and fancy gizmos. Water is basic and it's essential. Skin to skin is a form of not only having a baby hear a heartbeat and stimulating its endocrine system appropriately, it's also receiving warmth, and it's close to a place where it can receive food, the breastfeeding. And so these simple things matter much more than an incubator, than an ICU, than a water municipality system, but simple access to water and tricks of the trade that people can do in their own homes to make a difference. Because the care is ultimately up to the family. It's not going to be from a nurse, a midwife, or a doctor. They may come and give some information, but they are not actually going to provide the care.
Fantastic. A little goes a long way. Thank you very much for joining us.
Hi.
How was the experience?
Wow, that was toughest one I really had in my life, because it's really difficult to hand the water can plus your baby, so it's a very tough task. So I feel like the women who are carrying these babies plus the water, so it's really difficult task. And how they're supporting their families, and they're working for their families. Wow. And I'm, my breath is like up and down. I'm breathing like asthmatic, patient. So it's difficult task. Now how the women are doing this, and even in my part of region, in my region, there are women who are working like this, and
there like this, and I never thought that this would be like so much difficult, carrying the baby with the water or like this. So it was a very difficult task.
So how did the experiment make you feel?
It was heavy.
It was heavy. Okay.
Also, it was not it was not easy to handle the baby as well as carry it until here, since it's really heavy.
So 35% of healthcare facilities in developing countries do not have access to clean water for women when they're going into labor. How does this statistic make you feel?
I'm sure it's alarming, and I can't imagine women doing this every day. And even for one time, I'm unable to do this.
Hi, so I'm Kate Norgrove. I'm Global Head of Campaigns at WaterAid. Well, in particular, I wanted to focus on women giving birth, and I wanted you to imagine, if you can, a situation where you're having to walk 10 kilometres or more to get to your local health centre where you're going to be giving birth, carrying many litres of water that you need to bring because the health facility itself doesn't have any water. And then you get to the health facility, there's a lack of hygienic conditions because cleaners and health staff are unable to clean the facility without water. Then you've got a situation where midwives and yourselves aren't able to wash your own hands before delivery. You can imagine how infection spreads. And in fact, 1 in 5 newborn deaths could be prevented through more hygienic conditions and skilled health attendants being able to wash their hands with soap.